for part 2 of infection control BDA sheet. Yesterday we covered a few of the topics, and today I'm going to cover the decontamination process. As we all know, at the end of the each patient treatment, all instruments selected for use, used and unused, must be cleaned and sterilized. This line is really important. It should be used and unused instruments both. And then the decontamination process includes pre-sterilization. Okay, the decontamination is the process that includes a few various steps like pre-sterilization, then cleaning, disinfection, inspection, sterilization, and storage. And we will go one by one and we'll read it, whatever is important in there, but you don't need to remember anything from these paragraphs. It's just a one single good read is enough, but you don't need to remember anything from there. Now moving to the pre-sterilization cleaning is just like cleaning instrument before sterilizing. So how do you do that? And it reduces the risk of transmission of infectious agent. And they weren't gonna ask you about this, but it's just like blood, saline, and iodine are corrosive to stainless steel instruments. So blood, saline, and iodine, these three of the things which we daily use in our practice, they are corrosive to stainless steel instruments and will cause pitting and then the rusting. So this line is really important. What does it cause? It causes pitting and the rusting. If allowed to remain on instrument for any length of time where a delay cannot be avoided, the used instrument should be immersed in a water or an enzymatic cleaner. Sometimes they do ask this question in the water or either enzymatic cleaner. Like sometimes they do give a question that, okay, the stainless steel instrument become corrosive, it causes pitting, so what should we do and in which medium we should immerse it, right? So either it's going to be water or an enzymatic cleaner, but we need to avoid the lengthy periods of wet storage. And after cleaning, the instrument should be rinsed in water, potable, reverse osmosis, or freshly distilled. Now moving towards the washer disinfector. Washer disinfector offer the best option for a validated process and remove the need for manual cleanings. So to remove the need of a manual cleaning is what is the washer disinfector, and that's the best option. Now it consists of the 5 stages. First we need to flush, then wash, then rinse, then thermal disinfection, and then drying. So you need to flush, remove the gross contamination water of less than 45 degrees centigrade, then wash, remove the remaining soil using detergent specified by manufacturer, then rinse, then thermal disinfection at temperature of 80 degrees centigrade for 10 minutes and 90 degrees centigrade for 1 minute. For example, the thermal disinfection temperatures are important. Then drying, heat, air removes the residual moisture. No need to remember this just a one read is enough, but what you need to remember, what I have highlighted on this. Then the washer disinfector, okay, that cycle parameters, nothing is really important, but sometimes they do ask the question related to the records for everything. For any BDA sheet, wherever you see the record, you need to remember by heart the time period that we need to keep the records. So the record should be kept for at least 2 years. For 2 years, for what? For washer disinfector. We need to keep the records for washer disinfector for at least 2 years. 2 years. Now the ultrasonic cleaning. Ultrasonic cleaning is an effective means of cleaning dental instruments, reduce the contact and contaminated instruments. They must be maintained and tested according to manufacturer. This is just a read, no need to remember it. Prior to ultrasonic cleaning, briefly immerse used instrument in cold water. Now that's the only difference here. So for washer disinfector, what do we do? And for pre-sterilization phase, we put in a water and then enzymatic cleaner. And for ultrasonic cleaners, we need to immerse the used instrument in the cold water with the detergent to remove the visible swelling. A container with a sealing lid is recommended when placing the instrument in ultrasonic cleaning. No need to remember this. This is just a read. Where instruments require wrapping and sterilizing in a vacuum sterilizer, they must be dried first using a disposable non-linting cloth. So they do ask this question, non-linting cloth, about how do you gonna dry the instruments by using a disposable non-linting cloth. Okay, That's not important. Then manual cleaning, that's does not need to remember anything. Like manual cleaning carries a greater risk of inoculation injury than other cleaning methods. Okay, that's fine. Now it's just like whenever you are going for manual washing, then you need to two dedicated sinks, one sink with a removable bowl, and for final rinsing, another. Use detergent specifically made manual cleaning and follow the manufacturer instructions, which should be does not exceed the 45 degrees centigrade. That's the only one thing that I think that's important because that's related to temperature. But other than that, nothing is in manual cleaning, so you don't need to remember it. Where instruments require wrapping and sterilizing in a vacuum sterilizer, they must be dried first using a disposable non-linting cloth. Now, dental handpieces, nothing is really important in this, but it's just like washer disinfectors are preferred if the handpiece can withstand this cleaning method, and washer disinfector can clean handpieces. So, washer disinfectors are preferred one. Now, over that, dedicated handpieces cleaners can be considered where the washer disinfector is not recommended. Okay, not really important to read anything from this. Now, inspection and function, nothing really important here as well. It's just like a non-oil based lubricant may be necessary where hinges are stiff, you can use that. And then quickly we need to go, this part is really important, then we're gonna read it in detail. The preferred method for sterilization in dentistry is a saturated steam under pressure. Though number one, need to remember that the saturated steam under pressure. Number two to remember here is the temperature of 134 to 137 degrees centigrade with a holding time of 3 to 3.5 minutes. Number one, steam under pressure. Number two, 134-137 degrees centigrade and the holding time of 3 to 3.5 minutes. Now there are three types of sterilizer that used specifically in dentistry: type N, type B, and type S. Now the easy way to remember is that type N is displacement 1 and N for non-hollow, N for non, and type is non-hollow, non-air retentive, and that's unwrapped or non-wrapped instrument. Something related with N or un that comes under in this heading. So unwrapped, non-hollow, N, and non-air retentive, so that's going to be type N. Type B vacuum, that's designed for hollow, air retentive, and packaged loads. Now type S is designed for specific load. S for specific. Now that's for specific loads determined by the manufacturer. So hollow, air retentive, and packed loads, it's type B. Specific load, type S. Type N, with everything comes with the N, comes under in the type N. So I guess it's gonna be easy to remember this way. We need to avoid loading and filled water reservoir daily using fresh distilled water or reverse osmosis water. So these are important. Where possible, then that's nothing too important, nothing such important. Then dental handpieces. Handpiece manufacturer will provide advice on decontamination cleaned using a validated washer disinfector. Further processing, type A, type B, or type S sterilizer is acceptable. So B and S is acceptable, although the presence of lubricating product means the handpiece is unlikely to achieve sterility. Not that important. Now daily tests include automatic control test, steam penetration test, were recommended by manufacturer warm up cycle before instrument can process. Now again, there's not that important here. Now the only thing important I told you and mentioned earlier as well, wherever you see the records that you need to remember by heart. So records should be maintained for at least 2 years as well for sterilizers. Now compare reading with recommended values. So if any are outside the specified limits, the sterilization cycle must be checked again. If it is unsatisfactory, again the sterilizer should not be used until the problem has been rectified by an appropriately trained engineer. Chemical indicators, TST strips, for example, demonstrate only that the instruments have been through sterilization cycle, not that they have been sterilized. Now, that's the something really important here. So, chemical indicators, TST strips, for example, demonstrate that only only that instruments have been through a sterilization cycle, not that they have been sterilized. So that's important. They do give this question. Now, instrument packaging and storage. So we need to protect it from recontamination, and storage should be wiped clean with detergent and alcohol wipes after each session. Okay, then wrap instruments, you can store wrap instruments for up to 1 year. That's important. For how long you can store the wrap instruments for up to 1 year. The sterilizer is determine when the instrument should be wrapped and can be wrapped after sterilization. Dried instruments can be wrapped after sterilization. Then type B, dried instrument can be pre-wrapped, and type S according to manufacturer guidance. Packaging should display the date of decontamination and an expiry date. Now the unwrapped instruments. Now the after the unwrapped instrument should be stored dry and be protected from contamination in a mini racks placed in cupboards or in a covered drawer inserts, for example, not an open work safe. Okay, at the end of working day or at the beginning of the next working day, you should process all the unwrapped instrument regardless of whether they have been used. So this line is really important, that at the end of the working day or at the beginning of the next working day. So at the end or either beginning of the next working day, you should process all unwrapped instruments regardless of whether they have been used. Now, according to this, there should be a separate decontamination room, should be used within a 1 week. Okay, then the impression prosthesis and appliance. Okay, they usually give one question from this part. Okay, what do we need to remember from here? That you should agree the cleaning and disinfection process with the laboratory and the label, the device to indicate the disinfected status. Okay, now immediately after the removal from the mouth, rinse the device under cleaning running water until it is visibly clean. Disinfect the device using cleaning material specified by the manufacturer, then rinse the device. This process should occur before and after any device is placed in the patient's mouth. So if the device is to be returned to the supplier laboratory, a label to indicate that it has been disinfected should be affixed to the package. So once you remove the impression prosthesis of any appliance, immediately after the removal, rinse the device under the clean running water until it's visibly clean. Then disinfect the device using the cleaning material specified by the manufacturer, then rinse the device. Okay, so for treatment areas, that should be separated. The wash basin should have sensor control, elbow, foot operator, mixer, tapes, and dispenser. And there should be liquid soap, not the bar soap. Okay, work surfaces and floor covering should be impervious. That's again the question, that work surfaces and the floor covering should be impervious and easier to clean. At the end of the clinical session, clean all work surfaces, disposable clothes or microfiber material, including the taps, drainage points, splash backs, cupboards, doors, and sink. computer keyboards and everything. Now water supplies. Now here comes another important thing, that the Legionella is the culprit that is really important to clean out. So from the dental unit water lines, so majority of the dental units harbor biofilm, a source of microbial contamination from water produced by the unit. So contaminated water may harbor potentially pathogenic organisms such as Legionella and Pseudomonas aeruginosa, and can be potential hazard to both patients and surgery staff. Okay, now the blood spillages. Now the blood spillage, we need 1000 ppm, and for blood contamination, that 10,000 ppm. We need to use the hypochlorite, and that's the concentration of the hypochlorite that we need to use. So use hypochlorite 1000 ppm available chlorine for cleaning and blood spillages. Solution for hypochlorite can be made up freshly using hypochlorite tablets and used within a week. That's not very important. The hypochlorite solution should be in contact with the spill for at least 5 minutes. This is important. So for 5 minutes, at least 1000 ppm for blood spillage. Now for hypochlorite, higher concentration of 10,000 ppm available chlorine is useful for blood contamination. You should start decontamination process quickly and avoid corrosive damage to the metal fittings. Do not use alcohol in the same decontamination process. Okay, so I'm going to end it here, and then we'll cover the rest of the part in the third video. And I hope that you like the video, and I hope that's informative as per regarding your exam. And if you like it, so just please put some comments, so that is going to motivate me to make more videos for you and make life easier for every dental student who is going to appear for the exam. I hope you like it. So please like my channel, subscribe it, so you can get notifications whenever I'm going to post a new video. Thank you so much.